this legislation. For years, Prince George's County had a tough time meeting its operating expense and the deterioration of the hospital plan itself. And when County Executive Baker stepped up to the plate, he said that he would like to privatize the hospital. It was the only publicly owned hospital, government-owned hospital, that he would step up to the plate, privatize it, create a partnership with the University of Maryland Medical System, which has 12 hospitals within its system. And in stepping up to the plate, that Prince George's County would put up $208 million, or 50% of the capital cost of a new hospital. The state basically, on a handshake at the time, agreed to match that money. At the same time, we agreed to cover the operating expenses of the hospital so it could stay viable while this contract was going on and while the hospital would be built. And it's very important to note that the arrangement with the University of Maryland and Prince George's County Hospital is not only important to the close to 1 million people in Prince George's, but also part of the shock trauma system, an essential part of the shock trauma system that benefits every area of this state. And when we came to the General Assembly last year, new administration, the $15 million that was supposed to be appropriated in the budget for Prince George's County operating expenses was left out. We put that back in the budget, as you know, Madam Chair and members of the committee, when you did your due diligence on the budget, and the governor did not release those funds. Once we came in again this year, the governor did not include the $15 million for the operating expense of Prince George's County Hospital. The $45 million that was supposed to appear in the capital budget for the Prince George's County Hospital was $27.5 million. Now, the problem becomes the lack of stability and predictability, not only for Prince George's County, but also for the University of Maryland Medical System. So the University of Maryland Medical System has to find efficiencies throughout its entire hospital system, whether it's on the Eastern Shore or Harford County or different areas of the state, to make sure it can cover its operating expenses and expand its services in the Prince George's County Hospital that is still in existence in Prince George's County. So to bring stability and predictability to this, both the President and Senate, myself, leadership in both houses, county executive, chairman of the delegation, the support of the University of Maryland Medical System have come together to create this legislation that would create that predictability. That in this year's budget there would be $15 million for operating expense, would be done annually for the next couple of years of $15 million. That the capital budget would include $45 million this year, $90 million the next, and $18 million. Now, if we don't do that, what happens is University of Maryland takes over, they have to pick up that debt. They have to pick up the debt. And in all fairness, it was an agreement made by the state and Prince George's County. And what this bill basically says is the state of Maryland will live up to its obligation to the medical system of the state of Maryland and Prince George's County and throughout the entire state with the University of Maryland Medical System. And with that, I would ask either the chairman of the delegation or my good friend, the county executive, to make comments.
Mr. County Executive.
Very good. Thank you, Mr. Chairman. Madam Chairman, Madam Vice Chair, it's good to see you. It's good to be back in the old committee, although it didn't look like this when I was here, so you get better accommodations. You know, the speaker did an excellent job in outlining how we got here today. I just want to recap some of the stuff that the speaker talked about and then tell you what our frustration is at the county. As he said, you know, the county's commitment to the hospital, which is a nonprofit, dimensions. The county, as long as I've been, you know, involved in politics in Prince George's County since 1994, we've been trying to figure out what to do with that system which was losing money. For years, the counties put money in, but then the state started putting money in, and we both got into the healthcare business. The idea was for, and I can guarantee you, and I've said this to the people of Prince George's County, we're getting out of the hospital business. We shouldn't have never gotten into it, and we shouldn't be into it. The state should get out of hospital business. That's why we have coming in. But in order to get there, we all took on burdens. For the county, we put $208 million in capital funding, the largest project in Prince George's County's capital history, $208 million. We put $105 million of county operating funds that we've committed since 2011, including this year's budget for fiscal year 2017. We have agreed, and this was not an easy one, and the Vice Chair can tell you this firsthand, to get the council and the county to agree to absorb $40 million of bonds for Dimensions. But that was all to get us to where we've committed to be, and that is for the state, the county, and Dimensions and to move forward and build a new regional medical center that not only serves Prince George's County, but the southern part of the state. Not only providing access to quality health care, but also we put it at a metro center. So Largo Metro Center, where we'll have economic development around the hospital. You know, we signed the MOU with the previous administration, the O'Malley administration, but that wasn't between the O'Malley administration and Rashawn Baker or Neil Moore at Dimensions. It was between the state, the county, Dimensions, and that we would all live up to our portion. That's very hard for a county which last year had $115 million budget deficit, but we found the money. We're facing a budget deficit this year, but we're committed to putting the money. So you can imagine my shock and the people back home when I told them not only after the work that you did here in this committee and the people in the Senate, for the $15 million last year, which is the state's portion, after we put in money, after having a $115 million budget deficit, they're shocked that the $15 million, which was committed by the state, was not put in by the governor. We gave them all the information. We met with the governor's office. We still don't have that money. Now, we can't make up the deficit at Prince George's County. Certainly, I think can't make up the deficit, and I know that Dimensions can't. So it was a double shock this year when it wasn't included in this year's budget. So I think it brings us to where we are, and I've sat in the seats that you're sitting in, and that is there's got to be surety. There is no way or their board can feel comfortable if the state and the county don't live up to its obligation. If the people in Prince George's County or the county council decided tomorrow that it didn't want to fund the hospital, that would send shivers through the spines of not only but this body right here. So we're simply asking that, one, when you see the governor, because I'll ask him when I see him, that he release the $15 million from last year. And two, we think it's important that we codify in language the commitment that we all made. And that's what this bill does. So I want to thank you, Mr. Speaker, and the President of the Senate, and the people who signed on to this bill. With that, Madam Chair, I'll turn it over to our chair of our delegation.
Thank you, Madam Chair, members of the committee. And also I have to say this for the first time, thank you to the new Vice Chair of Appropriations, Delegate Gaines. I'm here on behalf of the Prince George's County delegation, just to let you know that since I've been the chair of the delegation for the past 2 years, our #1 priority has been finding a long-term solution for the hospital. I'm pretty sure that #1 priority goes back prior to me taking over as a chair. It also probably goes back to when County Executive Baker first came into office. We believe that Prince George's County needs to get out of the hospital business. I will say that again. Prince George's County needs to get out of the hospital business. As we continue to grow our business tax base, which has been a priority for us, the simple question is, how can you grow your business tax base if you can't offer quality health care to the workforce? And that's what we are trying to do by partnering with a world-class hospital system like the University of Maryland, which we all take pride in. I'm pleased that my colleagues around the state have really gotten behind this effort here. And the one thing that you know, with anybody with a business background, the one thing you have to have is predictability and stability. We had a memorandum of understanding with the previous administration, but with elections come consequences. We're looking for predictability and stability that we can go back and take to the almost 1 million residents of Prince George's County by having Prince George's County get out of the hospital business. That being said, I think the coach and the county executive did a great job with their presentation. Thank you for your time.
Delegate Gaines.
Thank you, Madam Chair. I do have one question. I know the governor recently released a supplemental budget. Was that for 16 or 17? I know we fenced it off, and my hope was that it was the 16 and that he is planning to submit another supplemental with another 15.
I believe it's for 17, and I believe the money for 16 is still fenced off.
Yes, but we'll be glad to have the money for 16 Delegate Gaines.
I can tell you, we really do need it.
Thank you, Madam Chair. First of all, I am a product of Prince George's Hospital. Was born there on March 5th, 1969.
Does that make you an alumnus?
I think it does. I think it
sign you
does.
up.
Gentlemen, if you could just answer one question. The previous MOU we've touched upon, was there an expiration date on that MOU?
Right. The previous MOU, it expired in 2015, which is why we talked to the governor when he came in and talked about Prince George's County #1 priority, which is what our chair said, and the hospital was there. Because the agreement, just like when, this agreement extends past the Baker administration as county executive, but the commitment is between Prince George's County, the state, and Dimensions.
Okay.
And let me just add this, what this bill will help do is codify that so you don't have to go through this every time. That's why this bill is so important, so that not next year or the year after that, or when is about to take over the hospital and we get amnesia. This will codify it. That's what makes it so important.
And I guess my only question is, thank you, Madam Chair, is that correct that it was an agreement with the previous administration, and I understand going forward that this codifies the existing relationship, but that MOU was satisfied with the expiration date of 2015, correct? And I guess going forward, I'm not trying to dismiss the merits of going forward, but that contract was satisfied.
Right. But here's the only thing, and you're correct, but here's the important thing we have to remember. One, that's why codifying this in the bill is important. But the other thing is the $15 million from FY16, this body, this legislative body, after hearing said was important and roped off the money. The information we got from the governor's office was not a disagreement about whether the hospital needed the $15 million. It was whether they needed information, which they were handed information. So it wasn't a disagreement with the Hogan administration as to whether the state is committed to the hospital system. It is, where is the money? And now that the state has a surplus, what we're saying for the governor is, I don't know why you just don't release that $15 million and then let this bill take us forward.
Okay. Thank you, gentlemen.
Delegate Barnes.
Thank you, Madam Chair. I guess let me direct my question to Chairman Walker. On this MOU issue, correct me if I'm wrong, but the MOU done in 2011 contemplated construction beginning in 2014. And the funding to keep the hospital open would continue through construction. Is that right? And we actually haven't really finished that construction yet.
Yes.
So the MOU really, as contemplated, would continue the funding that we have in place under this bill.
Yep. And we all wish that the hospital would have been completed by now. But the key portion of this bill was the $15 million in operating budget. So if we don't have a hospital that's operating, doesn't have the capital to operate, then we're really putting the healthcare at risk. So we need to have the $15 million in the operating money to keep the hospital going.
Thank you, Madam Chairman. I mean, in the paper, it was just reported that there was an agreement made between yourselves and the governor. Mr. County Executive, was there not an agreement made?
No.
There wasn't. The governor hasn't agreed to fund the hospital. Recently, I thought there was, am I mistaken? Wasn't there an article in the paper 3 days ago, 4 days ago about some agreement or?
I can tell you, there is not an agreement between the governor and the Baker administration or the county. There's not. We've asked for an MOU. We've asked the governor to sign an MOU with us the same way the previous administration did, to commit, as Delegate Barnes said and as our chair answered. You know, the contemplation of building a new hospital is that the existing facility hospital will be in operation. Without the $15 million going forward, you know, for FY16, FY17, in those years, it won't go forward because simply the county cannot support it. So no, there's not an agreement that I know of.
And it seems like, if I may answer, it seems like if there was a commitment there or an agreement there, then we would have had the $15 million for last year, along with the $15 million for this year, and then moving forward. When I made the comments about predictability and stability, if we're trying to find a long-term solution, this is what this bill does. It brings the predictability and the stability, not, I may do it this year, I may not do it next year.
What is the what's the status currently of the hospital? Have you started construction?
The location has been secured where the hospital will go, and I think I won't speak exact on that, but we're further along the process than we've ever been. And I think if we get this agreement taken care of, then we probably have a start construction date.
Right. I mean, part of what we run into is, as Delegate Walker said, the site has been selected. We know where it's going to go. The negotiations have been done. But getting through the CON, when you get through the CON process, they ask about financing and predictability of the financing. So not having the $15 million from last year, not having an MOU with the administration, or having this legislation, then getting to construction, it makes it even harder. So we've got the site. We've negotiated with the owners of the site. We're all set to go. We're almost there. This is why it boggles our mind why the administration would. We figure this is a no-brainer. You know, you provide quality health care in the southern part of the state. It's the second busiest trauma center. You've got a world-class hospital coming to take it over. To me, it's just a matter of putting the money in there and cutting the ribbon.
Thank you, Madam Chair.
Thank you. Any other questions? Thank you very much.
Thank
you.
Madam Chair.
You're welcome. Now we're going to have John Williams and Orland Johnson. University of Maryland Medical System.
Madam Chair, I'm John Ashworth. I'm Senior Vice President in University of Maryland Medical System and Associate Dean in University of Maryland School of Medicine.
Yes.
We are here, in effect, representing the medical system, obviously in support of the issues associated with the funding as articulated in the bill. I think what would be best is for us to start with our two board members, Orland and the judge, and ask them if they could speak to the issue. Orland?
Thank you, Madam Chairman, Madam Vice Chairman. Good to see you as well. It's an honor to be here today. Myself and Judge Williams are two members of the Ombuds Board that happen to be resident in Prince George's County, and I've had the opportunity to be on the board for a number of years. I also have the privilege of also chairing the Economic Development Corporation for Prince George's County. So as I speak on this, I think about it from my fiduciary responsibility as a board member, but also the impact that it would have from an economic development standpoint in our county. We've been working on this process for quite some time, and the idea of really being able to deliver a first-class, what I would call a healthcare delivery system in the county has been something we've been struggling with and working for forever. But the idea that we have actually gotten to this point now where Prince Georgians, in terms of where we are located in Prince George, in terms of being able to also buttress our economic development arguments to demonstrate that we have a first-class healthcare delivery system is critical as well. We've probably got about $5 or $6 billion worth of economic development activity. We've been talking about, we got government agencies potentially moving to the county, and to be able to demonstrate that we are prepared to move forward makes a difference. I've been living in the county for almost 30 years, and as I told members of the Senate, I've had 3 children born, and not one of them were born in Prince George's County. And part of it was the search for trying to find the best healthcare delivery system that I could find. And the idea that you have a large percentage of our county having to run around and work around to make sure they have the best is probably not an efficient system. And pretty much if we have a very strong system, all that does is also buttress the state system as well. So I just wanted to say how important it is for this funding to take place. Very fragile in terms of all of the different moving parts. But sometimes you'll look and say, well, that's just a few dollars, it shouldn't make a difference. Well, in this particular process, every dollar is going to make a difference. And I just wanted to make sure to make that point as well. So thank you for your time today.
Judge. Good afternoon, Madam Chair, Madam Vice Chair. Nice to see you and the members of this committee. Unlike Orland, I have a few more years in Prince George's County. I've got 44. And I will say that 2 of my children were actually born there at the Prince George's County Hospital. I used to live in Cheverly for a number of years. But let me say this, this will be a boom, not just for Prince George's County, but for the entire state. This regional hospital proposes to serve 4 or 5 counties, not just the 900,000 citizens of Prince George's, but the entire region. And to be branded with the UPSA Imamantha on there will certainly support what we're trying to do. Let me say this. I had a tour of this hospital very recently, and what I discovered is that it's 70 years old, and the oldest hospital in the county, and it's it's poorly constructed in the sense that the space and the flow is just awful. While I was there, I saw a trauma patient being wheeled through the public access halls, and that just is just not proper. So you really need to think. All of us need to think about having a state-of-the-art professional regional hospital, which has the brand with the University of Maryland School of Medicine as well as UMPS. And I would urge all of you to think about what this would do for the state. And I took some notes when I was taking my view of the hospital, and they don't have an oncology department. They don't have a chest designation area, and they just need private rooms. Private rooms. Can you imagine hospitals today but not private rooms? It just doesn't make sense. So I would urge, again, you all to think seriously about trying to put the kind of money together in this place so that the citizens of that region would not have to go to D.C. and other places looking for adequate health care. So that's my point. Thank you all for receiving us, and I hope that you'll support this enthusiastically. Thank you.
I will take a few minutes to maybe just update you on where we are relative to some of the progress before I turn it over to Dr. Bartlett, who will give you some stories, real good stories about a lot of good things that we've been doing there. The MOU was signed back in 2011, and the goal of that MOU was to develop and implement and, in effect, transform the healthcare delivery system in Prince George's County. This is not just about the regional medical center. This is about putting in place a regional medical center anchoring a healthcare system that is consistent with what you all are going to be hearing a lot about in the future is, quote, population health initiatives that ultimately are designed to create better health in the community as well as taking care of the episodic care that is necessary. In the MOU, it cited about a $600+ million project. As the bill is articulated, 208 from the state, 208 from the county. The remainder of that capital project is by virtue of financing that would have to go through the University of Maryland medical system. And one of the things that Speaker Bush has articulated is the concern that the medical system has to make sure that its bond ratings are not somehow diminished as a consequence of moving into this project, and thus some of the reason for the importance not only of the capital support, but also of the operating support. So it sounds like we have secured right now the capital support. As the county executive has said, we found a site. And as a result of finding that site, we now have the architectural work done, and ultimately all the work that's necessary in order to submit a CON has been completed. And ultimately where we are right now is in the review process with the Maryland Health Commission and the Health Services Cost Review Commission. What is very important is that there's kind of three legs to this funding stool. One's the county, one's the state, and the other is the rate regulator and what we can get through our regulatory bodies. That is the work of the day for us over the course of the next few months. The question was asked, when do we expect that CON approval? We're looking to June, July to get that approval, and ultimately with that approval, that then launches our ability to start the construction, get the building up. And a very important point here, this bill basically assumes that we get that CON in this timeline. So it's very critical for us to stay on this timeline. Otherwise, the investments you all are making get stretched out longer and longer. We have got to get this CON approved. Ambulatory Care Network, another part of the MOU. Betty Francis, Pam Creekmore from the county, a lot of work relative to the county's design of an ambulatory care network with an emphasis on primary care. That's in place. Part of the MOU was creating a health sciences presence on the campus of the Regional Medical Center. That being done with the University of Maryland, Baltimore, and Jay Perman. That's in place. When we took the role, the medical system, of working with Dimensions and the county to deal with some of the issues, one of the big issues was around the legacy liabilities that Dimensions brought to the table. This had to do with the pension, it had to do with the debt, and it has to do with working capital. We pretty much have knocked down every one of those issues. And in relation, once again, to the operating support dollars, I would characterize the financials right now relative to making this project work as fragile. And when I say that, it means that every single one of the elements of this has to come into place. And the $15 million increments relative to support of Prince George, of Dimensions Health System and the University of Maryland Medical System, the incremental loss of that $15 million means we've got to go find $15 million of cost savings someplace in the health system to deal with that. And it's already very thin. The consequence of getting this bill in place really does secure that operating support that is critical to the overall financial stability of the organization. And I'll finish this up by saying the last area of focus relative to the MOU has been on Dimensions itself. Its operating model has been strained, thus the reason for the operating support. What we, as the medical system, have been doing is working with Dimensions, with Neil Moore, to make improvements. We have been making incremental improvements towards better operating results. We've been starting to control costs. We're getting there, improving efficiency, quality, huge focus on the quality, and laying the groundwork consistent with the building of the Regional Medical Center to move this new operating model into that new Regional Medical Center and ultimately into the ambulatory strategy. An example, the examples of what we've been doing are really embodied in our clinical program initiatives. And what I'd like to do now is turn it over to Dr. Bartlett to talk about those clinical program initiatives, because I think they are an indicator of what we can do in Prince George's County. Steve?
Thank you very much, Madam Chair. I'm Steve Bartlett. I'm the Executive Vice President of the University of Maryland Medical System and Surgeon-in-Chief, and I'm also Chairman of the Department of Surgery in the School of Medicine. And in mentioning the School of Medicine, we've heard a lot today about the University of Maryland Medical System's eventual involvement with the Dimensions healthcare system. But in fact, the School of Medicine faculty have already had substantial investment in Prince George's County, and specifically in the Prince George's Hospital Center. So by way of example, we now run the trauma program there, where we have a survival rate that's equal to the survival rate at the Shock Trauma Center in Baltimore, 98% survival. We also operate the emergency medicine program at all 3 practice sites within Dimensions Healthcare. We have an orthopedic surgery program as well as an orthopedic trauma program. And the newest and perhaps the most visible program is the cardiac surgery and cardiology program and anesthesiology program, all operated by the School of Medicine faculty. And by the way, I'm working from page 16 in your handout. If you look on the next page, what are the outcomes of the cardiac surgery program? Earlier this week, we had a press conference where we announced the extraordinary success rate of the cardiac surgery program that really started up brand new under a cardiac surgeon we recruited from the School of Medicine, Dr. Jamie Brown. Dr. Brown has been able to train the staff through share days on the University of Maryland Medical Center campus and bring up the kinds of staff from the Med Center to Prince George's Hospital Center to allow us to start a program. And from the first case to the 146th case, we've operated with complete safety. As you can see, we've done 146 cases with no deaths. The Society of Thoracic Surgery predicted death rate would have been 2.4%. There have been no major complications and outcomes that exceed national standards. In fact, when this program gets its first rating from the Society of Thoracic Surgery, it will be a 3 out of 3-star program. Only 5% of the programs in the United States can claim that designation. If you look on the next page, you can see that the outcomes have been extraordinary. Almost no complications, no infections. No one has been on the ventilator for a prolonged period of time, and no new kidney failure. Even more amazing is that 84% of the patients will get the breathing tube out within 6 hours after their surgery. That's better than a national average of 47%. But the best data of all is on the last page, the length of stay in the hospital. Only 5 days after major heart surgery compared to other programs nationally, 6 days. What that means is that the cost to operate the program is superior to any of the competitors. And what that means is they have now established themselves as the principal cardiac surgery program for Prince George's County and Southern Maryland. And we believe that that will be a sufficient number of cardiac programs for this region. The last program I want to feature for you today is the orthopedic surgery program led by the chairman of orthopedic surgery, Andrew Pollack. When he arrived with his team at Prince George's Hospital Center, they were doing 165 cases. Now he's doing well over 600 cases with a 52% growth. Even more amazing is what you'll see on the next page. In Cole Fieldhouse, there's a restoration project where he is establishing a Center for Sports Medicine, Health, and Human Performance. There he'll be doing sports medicine outpatient visits at a rate of 8,500 visits per day. And when patients who are seen in that office need surgery, it'll be done at the new regional medical center. And there will also be a sports medicine adjunct site where patients can be seen on the regional medical center campus. The last point I want to make before I close is that a major part of this project is to have all the patients who now are hospitalized outside of Prince George's County, particularly in Washington, and if you took it Prince George's County and the Southern County where they're now being admitted, 30,000 are leaving the area and being admitted in Washington, D.C. We plan to turn that tide back into Prince George's County. What does that mean? For every 5,000 patients we repatriate, we will create 800 new jobs. This is going to be extraordinarily important to the economy of the state of Maryland, the economy of this region. And for this region, I strongly support this bill. Thank you.
Thank you, Madam Chairman. From the University of Maryland system, I just had the same question. I thought that the governor and the University of Maryland system had come to an agreement 4 days ago concerning funding of $55 million. Is that not true, or I'm confused? Can somebody explain to me?
It is true that $55 million has been supported by the governor, unequivocally.
And there was an agreement with the University of Maryland medical system 4 days ago for $55 million?
Yes.
So is that is that the same amount as it's in this bill, or how is that different than this bill?
Yeah, this bill also has in its other features, including assuring that the CON, the certificate of need, is approved, and approved, I believe the bill says, by July.
The bill would ensure that the CON is approved?
Well, certainly encourage it. They can only encourage it occur because of the firewall between the legislature and the Maryland Healthcare Commission.
So the bill, I'm sorry, this isn't my, I don't know, I'm not a doctor, so how does the bill encourage the certificate of need? How does that work? It just says, we'd like you kindly to do the CON? Or?
I think the way to answer this question is the need for the dollars is essential to get this project to move forward. And the bill articulates what is necessary in order to get the project to move forward. It also provides evidence for, as we walk through the financials with our rate regulator, that those dollars are committed, and as a consequence of that, hopefully sends a strong message to the rate regulator that given the reasonableness of our ability to get additional rates, that we can make this project work.
So that's what helps with the CON?
Absolutely.
The money, by guaranteeing the money, that helps with the CON?
Absolutely. It basically is a foundation to how we have submitted our financial projections, which has to be approved by the rate regulator. And what happens is the Health Services Cost Review Commission gives the Health Commission a, quote, comfort order, unquote, which in effect says, we believe that the financial projections hold tight, and therefore, Health Commission, we would support you. We provide evidence that the financial projections are good enough to make this project financially viable.
So if I could ask one last question, Madam Chairman. In the bill, it says that the bill would guarantee $45 million for 2017 and then $90 million for 2018. So what's the $90 million? Is that?
That's the last increment of the $200 million that is currently in the governor's 5-year CIP. So the schedule, the capital schedule, is different in the bill as opposed to what's in the governor's 5-year CIP. I can't remember the exact flow in the governor's, it's 45 and in the bill, it's the 45 and 90, and the capital's governor the 5-year CIP, it spreads it one more year. Given that we had the operating dollars, we could probably work with that capital, the difference in the capital, but the operating dollars are critical.
Okay.
Did you follow?
Is the agreement with the governor that was reached 4 days ago with the head of the University of Maryland Medical System, is that sufficient to get the hospital built, or no?
I think that there's one area that is not being addressed in those discussions, and that's the fiscal year 16, $15 million, which has been walled off.
Thank you. Thank you, Madam Chair.
Thank you, Madam Chair. I guess one of the reasons what really started this whole process was uncompensated health care, and that started, the request from Prince George's County and the legislature to provide operating capital and funding. Once this project is completed and the hospital is built, then it becomes part of the University of Maryland system. And will there then be continued need for any operating revenue from Prince George's County or the General Assembly?
The goal is that the dollars that you all are putting in now are investments, so that over the period of time, the second year into the operation of the medical center, those investments would be complete. And therefore, there would not be a requirement for any further operating subsidy. Now, having said that, we need our rate regulator to help us establish the right rates. That's the third leg of the stool in order for us to make this project work.
So you're saying you will need or will ask for operating capital up until the second year of operation of the new facility?
Yes.
And after that, you can't say unequivocally that you won't then continue to ask for operating money?
The proposal is that we would not be asking for it, but we have to work through our rate regulators so we can figure out whether that is possible.
And then just one final question, if I may. Due to the uncompensated health care, and obviously now we have the Maryland Health Insurance Exchange, and what even with under the current medical with the medical funding and with insurance funding and with Maryland Health Insurance Exchange, do you still have a large unfunded amount of uncompensated health care at the facility? Do you still have that, and do you see that going forward?
The answer is that uncompensated care rates have decreased because of the health exchange. Excuse me again. However, at Prince George's Hospital Center right now, they still have a high level of uncompensated care. Keep in mind that that uncompensated care is built into rates.
Right.
So there is the dollars there to support that uncompensated care, but what it does is it causes the rates to be very high. And when we get more and more into a price-sensitive healthcare environment, that's not a good thing.
Thank you, Madam Chair.
Oops, I'm sorry, Delegate Barnes.
So,
No.
quick question. I think I'm right on this. The money in this bill is going to not dimensions.
The money in the bill.
That's great. And that's important to me. You know, I represent the Laurel area where we have had some issues with dimensions. And certainly I don't think that the way they've conducted themselves in a really undemocratic, secretive, and sometimes nefarious manner is good for any of us. And the way you all have conducted yourselves in just the opposite, in a very collaborative manner, I want to thank you for that. Very open and straightforward. We're really excited to have you guys come in and get dimensions out of here. And so thank you for that. And I'm happy to hear that the money's going to you all and not dimensions. Thank you.
Oh, that stimulated some more thought, Delegate Gaines.
It did. As a Dimensions Board member, I take exception to that.
Whoa.
We actually have open meetings, and we do our very best to be extremely inclusive. And we're very sorry if for some reason some people were unable to follow along with what was happening. Thank you, Madam Chair.
Oh, wait a minute. No. I don't think we should have a debate here. I know. We're not going to have the debate. We're going to have a good afternoon. and besides, my bill's up next. So. I just want to thank you, University of Maryland Medical System. Obviously, thank you. I do have one. How many hospitals across the state have you now?
12.
12, all across the state. Some of those hospitals would have closed?
I'll let the board members answer that question. Yes.
Probably, yeah. So thank you for stepping in and helping several regions of the state, I know, to ensure that they continue to have quality health care. Very important. Thank you.
Thank you.
Have a great day. All right, committee, we're going to